Health Canada has to this point been unable to implement a fast-track process so that provinces can get the new testing kits that they so desperately need.
We are incredibly pleased by how many innovative Canadian companies and individuals have put forward new solutions, and Health Canada is prioritizing and rapidly going through a process of evaluating these tests. But at the same time, we cannot compromise on not just the safety of individual Canadians through this test, but the safety of our entire country.
Welcome back. That was a taste of this historic event today, virtual meetings of MPs across the country. Zarlement, Parliament, Zoom Parliament, call it what you want. Federal government released their new national COVID-19 modeling data today as well, predicting well over 50,000 new cases of COVID-19 by next week. So, is it too soon for some provinces to start reopening the economy, sending kids back to school? Quebec's ready to do it by May 11th for primary and elementary school, though the Premier of Ontario, Doug Ford, said no way he's doing that. Why is there still such a shortage of testing? And should Canada now start an investigation about the data that came out of China in the early weeks of this pandemic? Let's find out. Joining us now is the Health Minister, Patty Hajdu. She's in Ottawa. First of all, always a pleasure to see you. Hope you and your loved ones are well. Minister Hajdu, provinces are starting to open up. Quebec is the worst hit. They're going to send primary school kids back and elementary school kids on May 11th. Let me just ask you straight up. Would you, if you had a kid in primary school, knowing what you know, would you send your elementary school or primary school child back to school in 2 weeks?
Well, thanks, Evan. First of all, I'll just say that provinces and territories are working with the federal government on an agreed set of principles that will help guide those decisions about who will do what and when. Ultimately, at the end of the day, you've asked me a direct question, would I send my child back to school? It would depend on the school, and it would depend on the process in the school in terms of protecting my child from the risk of contracting COVID-19. We know that the outcomes are not as severe for children, but we still don't know necessarily yet whether or not they are effective spreaders of the disease. So all of those kinds of factors would be running through my mind as a parent, and I would be actively engaged in having conversations with my school's administrative team, as well as my son or daughter's teacher.
Yeah, Minister, you know, you say the federal government's working on guidelines, but the provinces are already leaping ahead. Some have a calendar date, like Quebec. Some have benchmark dates, like Saskatchewan and Alberta, or rather Ontario. Will provinces be forced to rework their plans to reopen if they don't comply with the national guidelines, or does the federal government even have jurisdiction to do anything about it?
So those guidelines are now released. The Prime Minister has, I believe, released the shared principles and guidelines in a press conference or press release earlier today. These were worked out with provinces and territories, and they form some ways for provinces and territories to make decisions about how to move forward and what principles should underline those kinds of decisions. And, you know, I think it's very important that provinces and territories consider the shared principles and guidelines, because, in fact, what we've seen from other jurisdictions is if we don't have the health and safety fabric strong in each jurisdiction, then there is always a risk of resurgence, and that is even worse for the economy in the long run, in our perspective.
The Prime Minister talked about we need 60,000 tests a day. And he said there might not even be a vaccine ever. We're really far from 60,000 tests a day. When will we hit that benchmark, which seems critical?
Well, it's been great to see the level of work that's been happening at all of the provincial and territorial levels to increase their capacity to test, increase their lab capacity to find the results of the tests that they're gathering. And that's all going to make a big difference, because, in fact, it's not just as simple as getting the tests, it's having the capacity to process those tests. I think we're at the average of about 20,000 a day now. And, you know, we've got a ways to go, that's for sure. The work that we're doing in your earlier clip on validating new tests and new test capacity through innovative point-of-care testing, for example, is all going to make a big difference.
Minister, there's been a lot of criticism on the data that came out of the WHO and from China, especially that Canada trusted the WHO and that the WHO trusted China too much. Even Dr. David Naylor, who your government has appointed to lead a key committee researching a vaccine, said this cost us 2 to 3 weeks in preparation. Will you join other countries like Australia, the United States, France, and call for an investigation into how China handled the data, and were they transparent?
I think, we recognize, first of all, the value of an organization like the World Health Organization to be able to have an international response to issues of public health and new outbreaks of new diseases. Having said that, I know that the WHO itself is interested in having a post-pandemic review. Minister Gould spoke with Dr. Tedros just the other day, agreed that it would be of critical importance to be able to review the World Health Organization's response to the emerging disease out of China and its advice to international communities and countries like ours. So we will look forward to that work. But listen, Evan, I'll just finish my statement. We're in the middle of Canada's outbreak. It's extremely important that we retain our focus and our energy on getting Canada through this first wave and having the social and health safety network in place to live with COVID.
But to be candid, you can do both. We can walk and chew gum at the same time. Australia is doing it. We now we have now closed all sorts of borders internally and externally. But on February 17th, you said that the suspension of flights to and from China and closing the borders, and I'll quote you, was not effective at all as controlling the spread of the disease. You also said in the long term, they create a greater risk to public health. You also praised China as being very open. Were you wrong about that, Minister? And I think it's important to know that because we still got a long road ahead.
Well, I think, the praise that I offered China in the early days was based on their historic containment efforts. Don't forget, there were, multiple millions and millions of Chinese people under essentially confinement, if you will, for a very long time. In fact, in some of those cities, people are just getting back to normal. And that was a public health measure that had never been seen before. Those containment efforts ultimately failed. And, I will point to the fact that I stand by the remarks on that I made around borders. I mean, listen, we now have stronger measures on our borders. It became very clear that other countries did not have a good handle on what their outbreaks were looking like, including countries like Iran and Italy who were struggling. And so as the evidence emerged and as we found new challenges, of course, we took new measures based on the public health advice we were getting. And you know what? I am grateful for a country that believes in evolving science.
Listen, I get that too, but and again, I know there's a lot of COVID morning quarterbacking, but we're trying to get a sense of how our government made some decisions. On March 4th, you said borders will become less and less relevant as how we manage this. That actually turned out not to be true. We ended up shutting down our borders. I guess I'm trying to figure out, when did you realize that the WHO advice that you were following was actually not correct? And has there been an accountability and a reassessment of that?
Well, I think there'll be an opportunity to review the international health regulations that actually all countries, members countries of the World Health Organization agreed to. These are regulations that actually mandate, or I shouldn't say mandate, but strictly guide countries in terms of what to do when there is an outbreak. And of course, I think the outbreak that we're facing now is one that we haven't seen in 100 years. So is there an opportunity to review those guidelines? Absolutely. And as I said, Minister Gould had a fantastic conversation with Dr. Tedros, and we remain open to reviewing the actions of the World Health Organization. But I will also reiterate that it's important that we do have a global response, because at some point we will have to resume international travel beyond cargo and essential workers, and we will need to all be working together as a world to eliminate COVID-19.
I get that. I get that. But you and I both know that Canada had intelligence reports warning. New Zealand did. New Zealand did not follow the WHO advice because they knew from the SARS experience, which Canada had too, that this was going to be more serious, so they shut down things earlier. But just one last quick question. Today I just read an article, a report that said after Australia has criticized China and wants to investigate the transparency of China, the Chinese are threatening if they do that, they may stop shipping PPE. Is Canada worried that if we are too critical of China, they will retaliate? Is that why we're being so mute on the subject?
I would just reiterate that this is a global pandemic and that we need to work together with countries all across the world to come up with global solutions. We need to make sure that, of course, that we're being critical about the institutions that serve us internationally, and that we look for ways as we move forward to improve our work together and improve our capacity to prevent pandemics like this. But I will also say that if we don't work together, then we will never be free of this disease, and we will be at risk of even more severe outbreaks in the future.
Right. Listen, but I guess there's trust and verify and working together. Minister Hajdu, I know you're working extremely hard, and I appreciate you joining us as always. The Health Minister, Patty Hajdu, in the midst of this pandemic, your time always valuable. Thank you.
Thank you very much.